Benign prostatic hyperplasia is a disease of the elderly. As you grow old, the prostate tends to grow and it blocks the passage of urine, causing symptoms in 50% of patients 50 years old and maybe 80% of patients 80-year-old. And 2 out of 10 men are going to need surgery for this benign prostatic growth. So before, surgery was a traumatic life event because patients had to be in the hospital for a long time. They bled a lot during surgery and after surgery, and so it was a very tough operation, especially for old men. Since 2003 we have been using the green light laser, but it has been improving over time, and we have learned to use it better and better, and now we can confidently say that there is no room anymore for the old-fashioned operations. Hill Clinic was a pioneer user of this green light laser 2 years ago, and I think over 450 patients have been operated here.
Натрупахме много голям опит по европейските мащаби, а и дори в световен мащаб като бройка пациенти, като извършени операции. Разширихме обема на операциите до много големи простатни жлези, включително усложнени случаи с камъни, с друга урологична патология. Естествено с помощта на доктор Санче, който е водещ световен експерт в тази област.
The advantage of this laser is that patients can go home very fast after the operation. The chances of bleeding are very low, and especially 2 complications that were worrisome for men before, like impotence and urinary incontinence, are extremely rare with this technology.
Този лазер навлиза все повече и повече. Голямо него предимство е, че тази дължина на вълната, която го прави Зелен, в видимия спектър 532 нанометра, е дължината на вълната, която се абсорбира максимално от хемоглобина. Тоест цялата енергия навлиза в тъканта и цялата енергия, която има кръвене, се абсорбира от кръвта. Затова се получава много бързо кръвоспиране. Тази операция е трансуретрална, т.е. прониква се през канала, няма разрези, протича сравнително бързо, за около час и половина-два.
Patients usually are operated with spinal anesthesia. That means that they are conscious, they're just put to sleep from the waist down, and they keep a catheter usually overnight. So the next morning the catheter is taken out and they can void, initially with a little bit of blood, but it clears out very fast, and then they can do normal life. Typically a patient will go home the next morning after the operation, and he would go back to his normal life after 3-4 days. You know, before, many patients who had a catheter because they couldn't pee, they couldn't void, were not good candidates for surgery because they were too old. They were having anticoagulation medication for their cardiac problems, so these patients were condemned to carry a catheter for all their life. And nowadays we can operate every patient with green light.
Този лазер ни дава възможност да оперираме пациенти, които не желаят или не могат да бъдат оперирани по конвенционалната методика. Тоест това са пациенти, които получават някакъв вид разреждане на кръвта, дали заради стентове, които са им поставени коронарни, или някакъв вид съдова патология, като инфаркти, инсулти. Пациенти, които не могат да бъдат оперирани по класическия начин. Лазер ни дава този тип безкръвност, дава ни тази прецизност, която ние това можем да го направим за сравнително бързо време.
The risks of green light laser surgery are very low. As I said, the transfusion rate with normal surgery goes between 3-4% to 20% with conventional surgery. With the green light is less than 0.5%. It's very strange that a patient will need blood transfusion. The incontinence rates are lower than 1%, and the impotence occurrence is anecdotal. It's very difficult to see a patient who complains of erectile dysfunction after green light. There's very little pain in this operation. Very little pain. It's very well tolerated, and many patients, especially those patients who were operated with a classic operation some years ago, when they have this, they don't believe it, because the recovery is extremely fast and painless, comfortable for the patient. It is no longer a traumatic life event as it was before.